Bronchial asthma. Bronchial asthma is a chronic inflammatory disorder characterized by periods of reversible bronchospasm. So, in asthma, here there will be bronchospasm, but it is reversible and it is a chronic inflammatory disorder. Okay, so in asthma attack, what happens is here there will be bronchospasm occurs. In this picture, you can see that there is constriction of airways. Normal airway, it is not constricted, but due to triggering factors, there will be inflammatory response and the airway is constricted. So that's why the person is not able to breathe appropriately. So that is bronchial asthma. Here there will be bronchospasm occurs due to inflammatory disorder and this bronchospasm will be reversible. The main etiology or risk factors of bronchial asthma include, it is known as triggering factors. Okay, so the first one, hereditary. Hereditary means in the patient family, is there any history of asthmatic attack in parents or grandparents? The offsprings may get chance to get this disease. So that is hereditary. Hereditary means genetic occurrence. In the family, there is history of asthma. Then the offsprings also has the chance to occur this disease. Next one, allergens, especially dust mites, pollens, cockroaches, then fungal growth. All these allergens may cause asthma. Then air pollutants, especially fumes, perfumes, aerosols, all this may cause asthma. Then viral infections, the upper respiratory tract infections may trigger the asthmatic condition. Then drug overdose, especially aspirin, some analgesics, beta adrenergic blockers in hypertension, all this may cause asthmatic attack. Then occupational exposure. Occupational exposure include fumes, chemicals, wood dust, vegetable dust. That also a risk factor for asthma. Then environmental factors. Environmental factors means climatic changes, the sudden climate change, exposure to cold, that may cause the asthmatic attack. Then psychological factors. Psychological factors, especially the stress, emotional factors, then hormonal factors, all may cause the asthmatic attack. Then some patients related to nose and sinus problems, especially sinusitis, rhinitis, all this may cause asthmatic attack. And some patients with GERD, gastroesophageal reflux disease, the regurgitation may occur due to incompetency of the wall, that is GERD. So here there is a risk of asthmatic attack. Then food additives, some colors, the food additives, some colors that used in food, then taste of potatoes or some materials that increase the flavor of the food, that may cause the asthmatic attack. So these all are the etiology of the asthma, that is hereditary, allergens, air pollutants, upper respiratory tract infection, drug overdose, occupational exposure, environmental factors, then psychological factors. The pathophysiology of bronchial asthma, the triggering factors or the etiological factors that cause airway inflammation. Airway inflammation leads to hyposecretion of mucus, airway muscle constriction, and swelling of bronchial membranes. So, what happens? There will be narrowing of breathing passage or narrowing of the airway occurs. So, that leads to the signs and symptoms of wheezing, cough, shortness of breath, tightness in chest. So, actually, what happens in pathophysiology is when we are exposed to these allergens or the triggering factors, there will be IgE stimulation, immunoglobulin E, that is for the allergic reactions, IgE for the allergic reaction. So IgE is stimulated by lymphocytes. So IgE attaches to mast cells or basophils. So what happens? The mast cell will be degranulation occurs, and there is release of lot of chemical mediators like histamine, bradykinin, leukotrienes, all those things. So what happens? They will act on bronchial smooth muscles, membranes, and also the secretion, hypersecretion will be increased. And also it has an effect on blood vessels. There will be vasodilation, increased permeability, and the edema will be occurs. All this leads to the narrowing of the breathing passages, and that leads to the signs and symptoms due to this infiltration or the inflammatory process. Okay, so that's regarding the pathophysiology. Next one, asthma classification. Asthma, based on the severity, it is classified as mild intermittent, mild persistent, moderate persistent, and severe persistent. So, in mild intermittent, the symptoms will be classified as daytime symptoms and nighttime symptoms, and also the occurrence in less than 5 years of age and more than 5 years of age. So, in daytime symptoms less than 2 per week. In mild intermittent, there will be the daytime symptoms will be less than 2 per week, nighttime symptoms also less than 2 per month. And there will be excellent tolerance to exercises. Then peak expiratory flow, that is greater than 80%, and peak expiratory flow variability is less than 20%. But in case of mild persistent, the uh, signs and symptoms that will be greater than 2 per week but less than 1 per day, and greater than the nighttime problem will be greater than 2 per month. And exercise symptoms, so when the person is doing exercise, there will be signs and symptoms of exacerbation, or the person will have the dyspnea. And PEF, that is greater than 80%, and PEF variability, that is 20 to 30%. Then moderate persistent, the person will have daily symptoms. That means the person will show the signs and symptoms daily. That's why it is moderate persistent. And nighttime signs and symptoms, that is greater than 1 per week. And frequent exercise symptoms, the person when they are doing exercise, the signs and symptoms will be more. And the peak expiratory flow, that is 60 to 80%. Then PEF variability, that greater than 30%. In case of severe persistent, there will be continuous day symptoms. So during the day itself, all time the person will suffering with dyspnea, cough, all the features. Okay, the person will have lot of problems due to the constricted airway. So it is severe and persistent. Most of the person will have severe dyspnea and oxygen will be reduced. And night time, frequent night symptoms. The person is not able to sleep due to dyspnea and tachypnea. Okay, then when we are doing exercise, the person is not able to do exercises. It is severely limited. When he is just walk itself may cause dyspnea. And PEF, that is less than 60%. It is less than, that is very important, less than 60%. And PEF variability, that is greater than 30%. So when you are remembering asthma classification, you just remember mild intermittent, mild persistent, moderate persistent, and severe persistent. And the PEF, that is less than 60 and more than 30 in severe cases, and they are not at all exercise tolerated the exercises, and they will have always the signs and symptoms. Okay. Regarding the clinical features, there are warning signs and symptoms. So, during the asthmatic attack, the person will have headache, stuffy or running nose. I already explained that when there is a sinusitis or rhinitis, there is increased risk of asthma. Then sore throat, due to respiratory tract infection, there will may be chance for sore throat, coughing and wheezing after exercises. The person may tolerate exercises, but after exercises the person may shows the symptoms of coughing or wheezing. Then difficulty in sleeping mainly due to dyspnea and tachypnea. Then feeling moody or irritable due to the signs and symptoms, the person may feeling moody or irritable. Then tiredness or weakness during physical activity. So when the person is doing any physical activities, there will be extreme tiredness or the weakness can be observed. In symptoms, mainly the person will say that there is chest tightness or something is there present in the chest. So chest tightness the person may feel, and coughing especially at night or when laughing. Okay, usually the coughing will be increased during night. Then difficulty in breathing. Most of the person will have dyspnea at night. Then shortness of breath, that also dyspnea and tachypnea will be the respiratory rate will be more than 30. Then sleep problems resulting in breathing issues. Then wheezing or whistling sound on chest when exhaling. So musical sound can be heard while the person is take breath. Okay, so nasal flaring. Some another feature is nasal flaring, and most of the person while during dyspnea they will use accessory muscles. Then pursed lip breathing also can be seen, and the person will be sit in upright position. Okay, orthopnea will be present, and tachycardia, widened pulse pressure, and excessive sweating may be present. Some person may show the features of cyanosis. Then when we are assessing the O2 saturation, the saturation level also will be decreased. The person will show hypoxemia. So these all are the signs and symptoms of asthma. Next one, the diagnostic measures of asthma. So in the diagnostic measures, firstly we have to assess the history of the patient, occupational exposure, then history of respiratory tract infection or history of allergens. All this history we have to take. Then physical examination. In the physical examination, what we have to observe is the musical sound, whistling sound you have to observe. Then spirometry also can be observed. Then already we in the history we will assess the occupation related chemicals or compounds, the presence of chemicals or compounds. Then sputum culture you can assess in order to identify any microorganism present. Then arterial blood gas analysis. Then pulse oximetry in order to assess the oxygen saturation level. Then pulmonary function test also helpful. And then chest x-ray in case of infections. Then a skin allergic test can be done. Then spirometry also can be done. Then the blood levels, Ig levels and eosinophils count can be assessed. Then pulmonary function test is the best method to identify the lung capacity. Okay, so these all are the diagnostic measures we are usually following for the bronchial asthma. So the medical management is very important in asthma. So the first management what we are doing is we will give the oxygen administration in case of sinused patients or breathing difficulty patient. Then we will give the proper position, and then we will give the nebulization, especially the quick relievers, in order to reduce the bronchospasm. So that's why we are using salbutamol, terbutaline, or adrenaline. Okay, all this will be used as aerosols or nebulization. So easily the spasm or bronchospasm can be reduced immediately. Then aminophylline infusion can be done. Then steroids, oral or inhaled steroids can be used, or puffs, Budicort puff or Duracort, whatever it is, the inhalers can be used. Then steroids, especially prednisolone or dexamethasone, can be given. Then theophylline also useful for the person. Then the drugs classification that we are used in asthma, it includes bronchodilators, beta 2 sympathomimetics, benzyl xanthines, anticholinergic. All these drugs can be used as a bronchodilator in asthma. Then uh, leukotriene modifiers, that is montelukast, okay, that you can use. Then mast cell stabilizers, chromoline or stabilizing cells, mast cell stabilizers can be used. Then methyl xanthines can be used, that is theophylline. Then corticosteroids, I already told, prednisolone or dexamethasone can be given, or hydrocort, that also can be given. Then anti-IgE antibody also can be given in the treatment of asthma. So mainly the classification is bronchodilators, leukotriene modifiers, mast cell stabilizers, corticosteroids, and anti-IgE antibody administration. Okay, so these all are the management. Complications of asthma include atelectasis, then bronchitis, pneumothorax, pneumonia, respiratory failure. The main complication of asthma is status asthmaticus, severe life-threatening condition in acute asthma. If the person is not respond to drug treatment, it's a very emergency condition, and the person is needed ICU treatment. So that is status asthmaticus. Then core pulmonale also can be occur due to frequent respiratory problems. There will be left side of the heart will be affected. Sorry, right side of the heart will be affected. Then pneumothorax. Pneumothorax means air in the lung. Pneumothorax can be occurred. Then pneumonia, that may be due to infection. Then bronchitis, also an infection. Then atelectasis means the collapse of alveoli can be occur. So complications of asthma, mainly the status asthmaticus, then atelectasis, bronchitis, pneumothorax, pneumonia, respiratory failure, core pulmonale also can be occur. So this is regarding the asthma. Thank you.